My patients often come to me saying they feel worse, but their MRIs stay stable. This is due to the high correlation of MRI with acute inflammatory disease. It is correlated most closely with a clinical relapse. But what is not explained on the MRI is a concept called smoldering multiple sclerosis. Smoldering MS is an underlying chronic inflammatory condition of the brain and spinal cord. This can be felt to be due to similar to a fire that is just chronically smoldering, but not overly or overtly aflame. This smoldering multiple sclerosis is correlates with what we historically have felt as progressive disease. We oftentimes felt that secondary progressive MS was due to a neurodegenerative disorder. We found though that progression does occur very early in the disease, and it can occur independent of relapse activity. We now have a pathological explanation for this chronic worsening despite stable MRIs, stable clinical exam. In these patients, we find that when we look at their lesions underneath a strong MRI magnet, there are features that would suggest chronic inflammation. This is different than what we would expect with an acute inflammatory relapse. And that is why when my patients come to me and ask, why am I getting worse, but my MRIs are stable, I can now have a pathologic explanation for why they're experiencing what they are experiencing.